Book 3 in the new Thinking Aloud dialogue series is UFOs and UAP, Are We Really Alone? Now available on Amazon.
New Thinking Aloud is presented by the California Institute for Human Science, a fully accredited university offering distant learning graduate degrees that focus on mind, body, and spirit. The topics that we cover here. We are particularly excited to announce new degrees emphasizing parapsychology and the paranormal. Visit their website at cihs.edu. You can now download a free PDF copy of issue number 8 of the New Thinking Aloud magazine or order a beautiful printed copy. Go to newthinkingaloud.org.
Thinking Aloud. Conversations on the leading edge of knowledge and discovery with psychologist Jeffrey Mishlove.
Hello and welcome. Today our topic is hypnosis and childbirth, and my guest, Dr. David Cheek, is an obstetrician and gynecologist, a former president of the American Society for Clinical Hypnosis, and the author of a book called Medical Hypnotherapy. David, welcome to our program.
Glad to be here.
It's a pleasure to have you here. You know, hypnosis is one of those strange terms that people don't understand very well. Many people are afraid of it. Some people say there is no such thing as hypnosis. How do you define hypnosis?
I think hypnosis is something that animals have been using for a long, long time before we came along. I think probably the most primitive form of hypnosis is hibernation. All living things have to be able to bridge periods of time when there is no food around. And in a hibernating state, we know that mammals that we've studied the most, and birds, warm-blooded animals, are very perceptive. They know what's going on around, even though they may look asleep and not be paying much attention to what they are surrounded by, unless there's something new that comes along that alerts them, like a human being sneezing in the presence of a hibernating woodchuck. You know, there have been studies done with animals that are hibernating that show that they can have a liver removed and not die until they come out of hibernation. There have been groundhogs that have been massively irradiated, show no changes in their blood or in their bone marrow until after they come out of hibernation.
It's sort of like a suspended animation.
Yeah, it's a dropping off of metabolic rate so that they can bridge periods of time when there is no food around. You know, even bacteria do this.
Mm-hmm. But how does that account for the process of suggestion that takes place in hypnosis?
Probably the best model of what happens that we see in stage hypnosis is what you see with birds and mammals, where the parent is taking care of the young. Mm-hmm. At a time of danger, the young have to center all of their attention on the mother and ignore everything else and absolutely obey what is dictated to them by the mother. You can see this with quail when you come on them in a path. Mm-hmm. They'll squat, they alert everything to their mother. And in a hypnotic state, we have very acute attention. There's global awareness, but specific attention. That's how we can get people to pay attention to what we're saying and to ignore pain, for example.
Global awareness, but specific attention. It's,
right.
It's as if it's a built-in biological survival mechanism.
Yes.
At a time of emergency where we really need to obey the commands of say, a parent.
Yes, or tap into knowledge that we've had from previous experience. Mm-hmm. This is probably what is the basis of time distortion, that an animal that's trotting down a path and comes up against a tiger out there that's hungry, it needs to know what it did the last time or have some genetic knowledge of what to do, and to do it instantly. You haven't got time to think, to reason with options.
So in other words, the state of hypnosis is one in which the resources of the organism really come to the forefront, are more accessible.
In terms of survival, yeah. Mm-hmm. And it may not always be the right thing to do. For instance, if a person goes into a faint state on a railroad track with their car stalled and does nothing, that might have been good if they were in a path in the forest with a tiger around, but on the railroad track it isn't adequate.
Yeah.
Do you see that a not moving catalepsy is part of this phenomenon that we see in hypnosis, where an animal will freeze
Yes.
and not move. It won't even flick an ear.
Mm-hmm.
And we can take a person who's in a hypnotic state and gradually lift an arm, for instance, and talk to them, and then leave the arm and it'll stay there.
Mm-hmm.
It's more economical to leave it there than to move to a new position.
So in recent decades, medical science has developed ways of using this biological process for medical purposes, to alleviate pain or to help in psychotherapy and things of this sort.
I'm not sure we should say medical science, because a lot of the contributions have been made with totally outside the realm of what we would call science.
Yeah.
But we're observing things that can be used scientifically, and we're learning now that there are releasing substances that the brain puts out that govern psychological behavior and physical behavior. And so we can begin to understand now how you can tell a person to stop bleeding when they're hemorrhaging and have them stop and go into a trance while they're doing it. These are basically activities that are governed by the very primitive part of the brain stem, and the reticular activating system seems to be the kingpin of the whole thing. It decides what to pay attention to and what to ignore.
And you routinely induce this trance state in your medical practice now, don't you? It's rather simple, isn't it?
Very simple. And the more acutely a person needs hypnosis, the more easily they can do it. For instance, I remember being called when I was a consultant in one of the hospitals here. One of the patients was in agony and labor, and her mother was standing next to her, wringing her hands and looking very upset. And I walked in. The intern had used all the drugs that he felt were safe for that woman in labor, that he didn't want to drug the baby too much. So I walked in and I said, I got rid of the mother, and I said, "Where have you been in an automobile lately?" And she looked sort of dazed for a moment, because that wasn't an appropriate question. That took her off balance.
Yeah.
And when you're off balance, you go into hypnosis. So she said, "Give me some medicine," and then she added at the end of the sentence, "I went over to see my cousin in Oakland last Sunday." I said, "Oh, what side of the car are you getting into?" And she told me. And she had a contraction, and then another one without any discomfort at all, because her attention was on what she was doing. And she was particularly interested in food, because she'd been on a diet. And she described the food, and where she had not been progressing in labor, she suddenly got fully dilated, and we took her down and delivered her.
Because you were able to distract her with the hypnotic process.
Yeah, there's another thing that we've learned about labor, for example, that if women are frightened, they will stop the expulsive part of their contractions. They'll go on contracting the uterus in order to get blood to the fetus, and when the uterus relaxes, new blood comes in. And if they're frightened, they will stop doing this. And we've learned from watching these beautiful pictures of the Serengeti Plains, and I've noticed as an obstetrician through the years that many women will come in active labor and then stop the progress for an hour or two until they get used to the hospital. And then they'll start up again. They're a little alarmed. It's a new setting for them. And we've learned that animals, for instance, all herd animals, the female at term will separate from the herd. All hoofed animals do
this. Is this what you're referring to when you said the Serengeti Plains?
On the Serengeti Plains, they have all sorts of hoofed animals, zebras, antelope, hartebeest, wildebeest, and there are lots of predators out there. Now, a female going into labor with the herd could get crushed if there were a stampede.
So they separate.
They're also more perceptive of what goes on around them. And if there are predators around, they will stop their labor, rejoin the herd, move into a new territory. See, hoofed animals can move, but the predatory animals stay in their territory. So they move into a new territory, the female then goes back into labor. In a hospital where a woman's afraid, all of her attention is on her uterus while it's contracting. She may think she's in active labor, so do the nurses, so do the doctors, because it feels like contractions, but they're not doing anything. And in this process, somebody may get alarmed. This is one of the reasons we're seeing a very greatly increased cesarean section rate, because after a while, if the mother's troubled enough, the baby's going to begin to get troubled too. Gets short of oxygen, gets stimulated so much that it loses its oxygen.
This is when the mother and the infant or the fetus at this point are sharing the same blood flow, the emotional
but also
hormones.
The mother's hormones, epinephrine goes right through into the placenta. And I think the babies also psychically pick up a lot from the mother. We're getting a lot of evidence now that there's great communication between mothers and babies. I don't say this to my obstetrician friends because this is not generally, understood or accepted at the moment. But if you talk to enough women and babies, grown-up babies, and use hypnosis to find out what their feelings were at the time they were born, you're going to get a lot of information that makes you feel there's more than just what they hear.
So this is a large part of your practice, I understand. Could you elaborate a little more, perhaps some examples of what you mean, David?
Yes. I've been very much impressed. You see, I did obstetrics for about 35 years, and as I grew older and wiser, I began to realize how much women are guided by their mothers and by friends, relatives, physicians in determining how long they expect to be in labor. And it occurred to me some time ago that perhaps we ought to talk it over with the mothers and babies. Now we're learning that babies have a lot to do with when a mother goes into labor.
How interesting.
And it seems, and the evidence is growing, that women are clairvoyant towards the end of their pregnancy. So I thought, as part of my project of working with obstetrical patients, that I would get them to hallucinate in hypnosis the time when they're going to go into labor, free of mother, free of all the others. We brainwash them, in other words. It doesn't take long to do. And get them to hallucinate and to signal with a finger when that part of their mind is forward to the time of their delivery.
Yes.
That they've had a nice short labor, and we've shown them how to anesthetize themselves to make themselves half as sensitive as they normally would be.
Now, when you say hallucinate, what you mean is to have mental pictures.
A mental picture of the labor, and sometimes even the labor room. They'll see it. And you ask them at the time that their finger signals that their baby is being held up for them to see. Some of them don't know the sex of their baby until we do this.
I see.
And to read off on a blackboard. They see an imaginary blackboard over somewhere, and then usually they look to the right. I don't know why this is, but the future seems to be to the right. And they'll read off, it's a boy, and it's the date, November 30th, and the labor is 3 hours and 20 minutes. Definite. I mean, that's it.
This might be an application of what people call creative visualization.
Yeah, it may not be creative. It may be the real thing with some of them. But you still have the taint of other people's opinions. So somebody will say, for instance, 15 hours. And I say, well, let's ask your fingers. You've got a finger that says yes, another one says no. Is there a deeper part of your mind that maybe you might make it for your baby a little shorter so it isn't so tough on your baby? And you usually agree with that.
The finger movements in hypnosis is a way of sort of accessing a deeper level of the mind, isn't
right.
it? Yeah.
You're nodding. That's a yes signal, isn't it?
Yeah.
And most people don't nod more than, they nod repeatedly. They don't just do it once. Same way with shaking your head. If you hear a politician you don't like, keep going from side to side. And the further away you get from head movements, apparently the more unconscious the information that you can reach. So if we set up finger signals, one finger, we let them choose it. One for yes, one for no, and one for I'm not ready yet to know this. I don't want to answer that question. And you may ask a question and they may nod their head and say yes, and a finger may say no. Well, you take the one that's further away from the head as a valid
Very interesting.
thing.
Now, how about the contact that the mother has with the unborn child? Does this occur during this process?
They seem to have a lot of contact. And
You even called it clairvoyant.
well, I think so, because they're looking forward into the future. You're getting a new... One woman I saw who had been a fertility problem, she found out why she was infertile, and she got pregnant and came to me to rehearse, because I don't do obstetrics anymore,
Yes.
for her delivery. She was going to deliver in a hospital over here in Novato, and she hallucinated the room, and she was troubled because she'd been to the hospital to look at it, and what she saw in the delivery of her baby was a room with tile, blue tile, about halfway up the wall, and it was white tile in this hospital. About 2 weeks after I saw her, she was transferred, her husband was, to Wichita. They had no idea they were going to be transferred. And
To a hospital with
about
blue
4
tile?
months later, there was blue tile in the delivery room. She delivered on the same day that she had, same time. The weight of the baby was exact. And I don't know what to think of this, but I have to pay attention to that. It isn't just, it just isn't chance.
Well, it's a sort of thing that parapsychologists would feel very comfortable with, I think. What about the relationship between the mother and the child?
Well, that's another one. I saw a woman who was going to deliver at home, and the doctor she was using, this is in another county, was troubled because she was a little overdue. I had worked with her to show her how to go into labor and how to anesthetize herself and have a finger squeeze that, made her numb. If she got uncomfortable, she could do that. And she was pretty cocky about it, but the doctor said, I want to start you in labor, and I had told her specifically, this is between mother and her baby. Don't let anybody start labor for you.
Oh, yes.
And she quoted me to him, which didn't make too big a
He must
hit.
have loved that.
At any rate, she called me in tears because he had said that if you get into trouble, you can't come to my hospital, you know, that sort of thing.
Yeah.
And she called me, and I said, you're a wonderful hypnotic subject. Why don't you go home and have a talk with your baby? She called me the next afternoon laughing. She said, I went home, and he said, she hadn't known about the sex of the baby. She said, he said that he'd be ready in the morning. And she said, I just got through delivering at home with no trouble.
Without the doctor?
Without the doctor. She had
How
midwives there.
interesting.
Yeah. But I don't know if that's sort of wishful. Maybe they think they're talking to the baby, but if you do this enough times, you get kind of respectful of what people do in the way of communicating.
Does this affect the later relationship then between?
Oh, yes. I saw a couple this morning. They brought their baby in that I'd worked with a couple months ago. The baby is a lovely, quiet little thing. The mother told me something that really blew my mind, because she said, I was so excited about having this baby. I went shopping and I was doing a lot of things, and she said, I heard this little voice inside me saying, I'm as excited as you are. I can hardly wait. She was sure it was that baby. But it's nice to see that thinking about the contact and the communication, because bonding between mothers and babies is not just in the delivery room. It goes on for months before. And these babies that have had a mother talking to them, patting their abdomen, you know, there's a Dr. Van de Kar across over here in Hayward, I think it is, who has what he calls a prenatal college. And he has mothers and fathers poking the abdomen, the pregnant abdomen, and talking to the baby, and they push it 3 times, and the baby kicks 3 times. Those babies come out in a wonderful relationship to their parents. It's really exciting.
Now, in your practice, do you sometimes have the mother, for example, get in touch with previous contact with the child, say past lives or karmic relationships, or some of the spiritual aspects?
Well, this is a real speculative area.
Of course it is, yes.
Some of the mothers who have had repeated miscarriages have felt in hypnosis that they've had the same little spirit each time.
Trying to get back again?
Yes. And what's very impressive about repeated miscarriages is that the first pregnancy occurred at a time that wasn't really comfortable for them. And apparently the babies, they think, the spirits, pick their mother. And if things aren't right and they miscarry, it's all right with the baby. They'll come back and do it again. Try again. This is one of the thoughts that comes out of this research that we're doing. And the the mother has miscarried the other maybe 4 miscarriages because she felt so guilty about not being ready for the first one and has miscarried.
Yes.
We see this sometimes with women that have had abortions, therapeutic abortions, because it wasn't a good time for them. May feel guilty about this and punish themselves by somehow miscarrying early in pregnancy.
So can you use hypnosis to help these mothers then
yes.
deal with their guilt
You find
by
out-
communicating with the
Found
unborn?
out you can get them, and this is another area where we use hypnosis to explore nighttime sleep. There's a very keen knowledge of what goes on in sleep. The dreams that we have are in a relatively superficial level of sleep, but a lot of the things that go on that have to do with bleeding, with pushing a fetus out, with a miscarriage, occur at deep levels of sleep. And they may call you in the middle of the night saying, I'm hemorrhaging. You say, well, now, let's see, which is your yes finger? This shifts them from being scared in their home to remembering how they were in an office where they were relaxed. So they say, my right index finger. And you say, fine. Go back to the beginning of last night's sleep. As you're falling asleep, your yes finger will lift. Each time you're dreaming, as you ordinarily think of dreams, your no finger will lift. Come up to when you feel something's going on that starts your bleeding. They'll signal, but before they signal, they'll look troubled. And you use that as an indicator of whether this is valid or whether they're just trying to please you.
Now, is this where you're talking to them over the phone?
Over the phone.
You can
But
tell
you
that
can
they
tell by
look
their breathing.
that
You
they're
can tell by the
troubled.
way they... And if you're watching them, you can see this, of course. So they'll say, I'm dreaming that I have a baby that looks like a cricket. Something that outlandish, and it frightens me. And that's when the bleeding. So you say, well, okay, now that you know this, can we all get some rest and stop your bleeding? And they'll say, my yes finger's lifting. Say, fine, call me in the morning. And we have this many, many times. Bleeding is very much under central nervous system control. And you can see why. If you're a wounded animal, it's good for you not to bleed, because that smells. That's a giveaway. So if you're in trouble, you stop bleeding, and you cool your surface, like people do in surgical shock. Surface is cool. You don't smell as much when you're cool. Birds do this.
But you're suggesting that the bleeding is somehow regulated by dream images.
Very much, because there's a stress phenomenon. If they feel they've got an abnormal baby, they don't want to have an abnormal baby. So they're not aware of that they felt guilty. But you can find out, go back to whatever it was that started you having this kind of a dream. Usually it's several nights that they'll do this. But then the critical time is when they start bleeding. They build up apprehension over several cycles, several nights sometimes.
Well, now we've talked about the ability of the mother to be clairvoyant and to come up with accurate information. Are these dream images not accurate if the child looks like a cricket or something frightening?
That's a metaphor. Metaphor for fear, basically. Fear that they're not going to have a normal baby because they did that thing.
Out of their guilt.
Which was totally unconscious. They didn't want to lose the baby, but they just were uncomfortable. It wasn't the right time. Baby didn't know that. Took a flyer at what it thought was a good place and lose it. But these are kind of beyond the fringe of ordinary obstetrical thinking, and I would
not recognized by mainstream medicine yet.
No, not yet, no. There's a lot more thought given to this in Russia and some of the places beyond the Iron Curtain.
Where do you see the future of this kind of work leading, if the work that you do?
Well, I would really, as an obstetrician and a humanist, like to see all babies wanted before mothers get pregnant, and to have wide enough abortion done so that there's freedom for an embryo to go on, pick some other place. I don't think life stops just with an abortion or with death.
In other words, what you're suggesting is that a mother can contact the unborn child even before the moment of conception.
That's one of the thoughts. It's a possibility. But most of all is to think about this little guy inside as not a reflection of husband or his mother and other people, Because very often an argument will start a miscarriage. Did you know that?
No.
An argument where a husband is saying something nasty and the wife gets angry. It's his baby that makes her mad. So it's his baby that may get pushed out. And this has come up very many times with abortions that have been wanted pregnancies, but they've aborted. And when they find out these things and they can correct it, they can understand, they treat that little guy as a separate entity all the way through. They'll talk to it as a separate one. If they get mad at a garbage collector or a grocerman, they talk to their baby, say, I was angry with him, has nothing to do with you. Keeping that viewpoint always, that it's their baby, but it's a separate individual. And somehow this makes a difference in the way they carry their pregnancies and the way they go through their labors.
Yeah. So the stress from the argument itself might lead a mother to cause an abortion, is what you're saying.
Oh, yes, yes. And when they know what has been a factor with them, then they can do something about it. For instance, if they've had miscarriages before, or they've had a recent threat of cramping and bleeding and have stopped it, we can ask them to set up their night so that they awaken if there's a threatening dream and realize it's just a dream. See, dreams are really real until you wake up. And
you know, you're kind of out in left field, I should think, for most medical doctors, in the sense that you're recognizing these psychological factors as being instrumental in the physical process of childbirth. Do you have more evidence other than your hypnotic experiences that confirms this?
well,
How do you know?
I learned to use some criteria when I was exploring what people hear under anesthesia. We've learned that people do hear. This is this alerting mechanism I talked about, the primitive part of the brain. When you're unconscious, it wants to know what's going on out there. It does not get affected by the anesthetic. So what I found I could trust and could validate with talking to the surgeon or knowing myself because it was my patient was that if we got a physiological evidence of distress, the breathing changed, you could see the vessels in the neck pulsate a little more rapidly, and this preceded a finger signal that says something's happening that's disturbing. And you ask them when that lifts, and they say, I don't know, there's nothing. So you get them to go over it a few more times, and then they say, oh yeah, the doctor on the right is saying it looks pretty dirty in there, it looks like a mess. They've been agitated by the mess part of it. Their first level of memory is physiological, then it gets up to a higher level where we move muscles, and then finally it gets up to where they can put it into words. Speech is the latest development of our mind.
And after many, many decades of clinical practice, this has become more than just an art form for you, almost a science.
Not only a science for looking, but also you can project a lot to people if you believe in them having babies, for instance. It makes a lot of difference to the patient to have people around them who have faith in their ability to do remarkable things. That's the great thing about it.
Well, David, it's been a pleasure having you on the program. We've covered so many dimensions, from the spiritual side of childbirth to the aspect, and we could do a whole other program on how adults seem to be able to remember under hypnosis events that took place in their own childbirth.
Yes, they can.
And how these things affect all of us. Thank you very much for being with me.
Thank you for asking me.
It's been a pleasure. And thank you very much for being with us.
Book 3 in the new Thinking Aloud dialogue series is UFOs and UAP, Are We Really Alone? Now available on Amazon.
New Thinking Aloud is presented by the California Institute for Human Science, a fully accredited university offering distant learning graduate degrees that focus on mind, body, and spirit. The topics that we cover here. We are particularly excited to announce new degrees emphasizing parapsychology and the paranormal. Visit their website at cihs.edu. You can now download a free PDF copy of issue number 8 of the New Thinking Aloud magazine, or order a beautiful printed copy. Go to newthinkingaloud.org.